Good morning. Um, my English is not so good, and I need to read this because for me it's very difficult to stay here, but I will try. Good morning. I'm Alessandra Dorca, and I'm one of directors of Procure of ALS from Brazil. And I will present a little bit about 60 years using social networking has a foundation of care, and we have a success of history. And it was a big challenge to create an association based on social networking. Talk about social networking is talk about very careful topics. Networking is a social network is a lot of good things, but there are a lot of bad things as well. And having credibility in this environment is very difficult. And we are going to talk a little bit about these 6 years and how we get to there supporting through the social network. Through the social network that he has free in the social network. He can learn from the video. I'm sorry, I think yes. And he can learn from videos with everything we have and can offer new learning. We can offer presentation of new techniques about new strategy, and especially the social network is a base of relationship. Relationships in health became, I'm sorry, I will put this. Relationships in health became very large. Several NGOs communicate through these social networks. We have people who related to each one knowing their problem. They know where to seek help for their problem. So the impact of social network has changed reality. Social network has changed the reality of history, care, interaction among people in the world. And the cool thing is that social networking has provide knowledge for everyone. That is when a new drug is being discussed here in United States or Japan or anywhere else, people all over the world hear about this. The worldwide works, the new studies having been recognized worldwide through social network. We know that it's so very dangerous because a lot of fake news has been spread, creating expectation and treatments that are often not real. They mislead the patient, but it is also opportunity for people to get to know and even seek treatment in other countries. So this impact is more comfortable for those patients who were often helpless without understand the reality. So social network has become this environment. I think this most important point we have about social network is opportunity for understand they are not alone. They are others with the same issues, with the same complaints, and and then up relating to other and realize that sometimes someone has a question or some doubt, and better yet, another hear the answer. So it is a way of realizing that the patient is not alone, that the patient or family or caregiver is not alone. It is the comfort of understanding that there are others with the same problem. The surprise for us in association is that in 2014, with the Ice Bucket Challenge, as well as several other associations, the ALS Procure become nationality recognized and known. We raised $250,000 with the campaign. We, who were a small social network, had a group that increased by more than 400%, and thus was born the largest amyotrophic lateral sclerosis patient group care in Brazil to care. It's true. And that we have grow a lot of starting arriving in place that we ourselves did not believe we could reach. Our biggest challenge was how to offer care and even equipment to people in so many places in the country. Brazil is a huge country and has very remote and difficult access areas. How to take care these people from so far away? That was our big challenge. Maybe the biggest challenge we trying to achieve for these people by delivering caregiving equipment, and today is the biggest challenge in the ALS Procure Association. In 2018, we saw the ask our professional how act in the social network. So we did a little research among our group, basically a cross-sectional work that month, and ask each professional to record how many times in that month he interacted with the patient or caregivers. Six physiotherapists participated in this small study, four respiratory and two morals, and two speech therapists, two nutritionists, and two psychologists. This study really surprised us because we was the number we actually had to answer these prompt patients. So we consider Facebook replies, Facebook post replies, video calls with other professional, WhatsApp calls, going to the patient home, especially when it is in the same city, and support staffing, training, and guidance from the patient support team at the location. It was an impressive result. We had an average 50 calls a day. That is, all professionals had on average 50 patients. Somehow we participated that routine with 50 answer or 1,500 calls per month, which gives us an average of 18,000 calls by WhatsApp or Facebook or Instagram per year. The answer that people had the most in the question we answered the most were, how do I breathe exercise? Uh, what is EMBU? The question regarding the nutritional part, I'm losing weight. I had a hard time gaining weight. Question about the use of non-invasive ventilating fans. What is the best equipment? What this equipment? What is life support equipment? Many condition related issues like I'm choking on myself. Why I'm choking so much? Psychology issues. Issues mainly between husband and wife, quarrels between husband and wife after discovery of their own illness, and many questions about daily life. How do I teeth brushing? How do I position my bed? What kind of chair? How do I bath? Basic things we offer. As such, we have already created a very large amount of information materials on the web. Our YouTube channel has 8,500 subscribed with the videos, explanations, and multiple lessons so they understand what caring for amyotrophic sclerosis lateral is. We have 650,000 views in the YouTube channel. And what they most seek, there's videos on breathing, exercise, and EMBU, calcification, on mechanical ventilation issues, tracheostomies, aspirations, live on nutritional counseling, and many classes, and even we have record and filming in our social network. We have some material, information material, as well as a medical alert that is available to every patient, so that when something happens, he has alert printed to deliver to the doctor or to the hospital. We have some models of home care petition by professionals we trust, lawyers we trust. We have already built booklet with practical guidance for caregivers, for patients, a booklet called "Do You Know?", which gives the patient a little more knowledge about the disease. We currently have 23,000 followers in our Facebook group. And when we make among lung cuts, so we can understand who are the people who follow us too much. We find that the most interactions are made by the southeast region that has effectively the largest population, the highest per capita income, and the highest level of knowledge. We were impressed because we have visualization in many other countries. This caught our attention mainly due to the great penetration we have in the United States and Portugal. Portugal is because it's by language similarity, and we believe that in the United States it is because an association is part of alliance. But we are impressed that we have followers everywhere in the world. In this chart, we put some sums of what is this. We have in Argentina, Spain, in several places, sometimes one or two, but 400 others follows from other countries in the world. Regarding the age and gender of those who accompany us most, we have more women because it's usually the female caregiver who take care of this. And the age group between 35 and 54 is our largest numbers of followers. This is a really cool video that we put into represent what our job is with the help teams and help teams in other distant states where those people who are sometimes anywhere of amyotrophic lateral sclerosis is located.
O programa Melhor em Casa ele é composto por uma equipe multidisciplinar que contém os profissionais como médicos, fisioterapeutas, nutricionista, psicólogo, assistente social, enfermeiros, técnicos de enfermagem e fonoaudiólogo. Meu nome é Cíntia, eu sou a fonoaudióloga responsável pelo paciente Enilton.
Eu sou Carla, fisioterapeuta.
Meu nome é Leiliane, eu também sou fisioterapeuta.
Na nossa cidade, o conhecimento sobre a doença ELA, que é uma doença rara, era muito restrito. Portanto, nós tivemos a necessidade de buscar informações e apoio. Foi quando conhecemos a associação, à procura da ELA, e buscamos um contato que de imediato fomos bem recebidas, acolhidas e inteiramente orientadas e capacitadas para dar um bom atendimento, fazer um bom acompanhamento aqui presencial do nosso paciente. Gostaríamos de deixar claro aqui, então, a nossa gratidão, né, e reconhecimento do trabalho da Associação Procura da ELA, que é extremamente relevante para os pacientes. Né? A gente tem consciência de que os profissionais de atendimento presencial eles precisam ter um maior nível de informações e capacitação, e essa associação ela vem se importando em trazer isso para nós. Então, gostaríamos de agradecer, né, na pessoa do presidente Jorge, por sempre nos apoiar, nos amparar e nos dar essa segurança de poder fazer um atendimento presencial com o apoio à distância da associação e seus profissionais. Então fica aqui nosso agradecimento.
E eu, sendo esposa do paciente Emilton, venho aqui também agradecer a associação desde o início, que me deu um suporte de todas as maneiras, não só de equipamento, mas como também umas palavras amigas, a ajuda, todas as ajudas necessárias nós tivemos. Eu quero agradecer a associação e especialmente também seu Jorge Abdala.
So in 2019, we also had a most significant milestone, which was our very cool new headquarters with a consultant room, a supply room, and a social work room. Our social worker is able to help us and support these people who will keep looking for us on social network. But now we have a physical space for them to resort to. There were have our equipment along with diet. When we need send something to one place or another, we send it. Today we are an existing, and this is our net. This is our association. This is a executive directors and deliberative council and fiscal council and scientific committee, steering committee, social network, and voluntaries. Together, we are strong. Thank you.